Did you know a stroke can strike in seconds but change a life forever? Every moment counts. A blocked artery or bleeding in the brain can cause sudden paralysis, loss of speech, or even death. But here's the good news. Most strokes can be prevented. In this video, we'll reveal the hidden causes, warning signs, life-saving treatments, and how you can protect yourself and your loved ones. Stay with us. This information could save a life. Fire: what really triggers stroke? Light bulb: can it be prevented? Pill: what are the latest treatments saving lives today? In this video, we'll break down everything you need to know about stroke, from its hidden causes to the most advanced treatments available. Stay tuned because this information could save a life. Let's dive in. Causes of stroke. 1. Ischemic stroke. Most common, 87% of cases, occurs when a blood clot blocks a vessel supplying blood to the brain. Causes include checkmark atherosclerosis, fatty deposits, narrow arteries. Checkmark blood clots can form in the heart due to atrial fibrillation, or in arteries and travel to the brain. Checkmark high cholesterol leads to plaque buildup in arteries. Checkmark diabetes damages blood vessels, increasing stroke risk. Checkmark smoking increases clot formation and artery damage. 2. Hemorrhagic stroke, less common but more severe, occurs when a weakened blood vessel bursts, causing bleeding in or around the brain. Causes include checkmark high blood pressure, hypertension, the leading cause of brain hemorrhages. Checkmark aneurysms, weak spots in blood vessels that rupture. Checkmark head trauma, injury leading to internal bleeding. Checkmark blood thinning medications can increase bleeding risk. 3. Transient ischemic attack, TIA or mini stroke. Checkmark temporary blockage of blood flow, lasting a few minutes to hours. Checkmark a warning sign for a full stroke. Risk factors for stroke, non-modifiable factors. Checkmark age. Risk increases after 55 years. Checkmark family history. Checkmark gender. Men have a higher risk, but women often have worse outcomes. Modifiable factors. Checkmark high blood pressure. Checkmark smoking. Checkmark diabetes. Checkmark obesity. Checkmark lack of physical activity. Checkmark excessive alcohol consumption. High voltage symptoms of stroke. Remember fast. Checkmark F. Face drooping. One side of the face droops or feels numb. Checkmark A. Arm weakness. One arm feels weak or numb. Checkmark S. Speech difficulty. Slurred or confused speech. Checkmark T. Time to call emergency services. Act fast. Every second counts. Other symptoms. Checkmark sudden severe headache. Checkmark loss of vision in one or both eyes. Checkmark loss of balance or dizziness. Checkmark numbness on one side of the body. Treatment of stroke. Emergency treatment. Golden hour. First 3-4 hours are critical. Checkmark ischemic stroke. Clot busting drug TPA, tissue plasminogen activator, is given within 4.5 hours to dissolve clots. Checkmark mechanical thrombectomy, a procedure to remove large clots using a catheter. Checkmark hemorrhagic stroke. Surgery may be needed to stop bleeding and relieve pressure. Long-term treatment and recovery. Checkmark blood pressure control. Medications to lower blood pressure. Checkmark cholesterol management, statins and dietary changes. Checkmark physical therapy, helps regain lost movement and strength. Checkmark speech therapy, for communication difficulties. Checkmark lifestyle changes, quit smoking, eat a healthy diet, and exercise. Stroke prevention. Checkmark control blood pressure, keep it below 120/80ths of a millimeter of mercury. Checkmark maintain healthy cholesterol levels, LDL below 100 mg per deciliter. Checkmark quit smoking and limit alcohol intake. Checkmark exercise regularly, at least 30 minutes a day. Checkmark eat a balanced diet, less salt, more fruits, vegetables, and whole grains. Checkmark monitor diabetes and keep blood sugar under control. Conclusion: a stroke is a life-threatening condition, but early recognition and treatment can save lives. Preventive measures such as controlling risk factors, leading a healthy lifestyle, and regular medical checkups can significantly reduce the chances of having a stroke. Thanks for watching. Stay healthy, stay safe, and don't forget to like, share, and subscribe for more health tips. See you in the